All right, so I wrote a message of the day, and I hope you go every morning and read it. It's free. BillO'Reilly.com has it. And I says, likelihood of military action against Iran soon. I don't know what soon comprises, but we're at that point now where the Iranians simply aren't going to do anything about it unless they're punished to an extent where they have to. And I assume with the polling numbers being terrible, and I would say 65% of Americans opposing the Iran action, President Trump's going to have to wind it up. All right? When he does it, I don't know. How it's going to come down, I don't know. We're working it like crazy, but be prepared. All right, back home. So lost in all of this Trump stuff is a very interesting case that the federal government has suspended $1.3 billion in Medicaid payments to the state of California. It's a lot of jack, okay? And the reason is, like Minnesota and Maine, and a few other states, probably more than we know, the states themselves were allowing phony hospital, phony stuff to be paid for, and then the states get reimbursed for that, so that we pay for it really, but it was bogus. So I asked myself, get somebody who really knows what this is all about. And I think we have it, Dr. Brian Blase, coming to us from Ponte Vedra Beach, Florida. He's the president of the Paragon Health Institute. He did once work for Donald Trump. You guys should know that. He follows these stories. And it's a grift, right? We're looking at, let's pinpoint California, first of all. So from what I understand, a whole bunch of hospices out there where people go and die, and they were either overbilling or they weren't in existence at all and said they were, and the state would just rubber stamp the payments so the federal government would reimburse the state of California. Do I have it correct?
Yeah, I mean, one of the things about the California hospices bill is that nobody was dying. You expect if people go into hospice, a pretty high mortality rate. And actually, there was a very high survival rate with the Los Angeles hospice. So there's two programs. The one we're primarily talking about is Medicaid. Medicaid is a joint federal-state program, traditionally for lower-income, more vulnerable Americans, like children, pregnant moms, people with disabilities. The key to understanding Medicaid is that the federal government provides an open-ended reimbursement of state spending. So the more the states spend, the more money that they get from Washington. That creates really bad incentives at the state level, creates a permissive environment for waste, fraud, and abuse. And it's really important when you have those incentives that the federal government provide meaningful oversight of state programs. And what we saw during the Biden administration in particular was sort of an anything, no holds barred approach to Medicaid. The program grew astronomically. In California, California now has a Medicaid program that costs more than $200 billion a year. About 2/3 of that is paid by the federal government. So a lot of this waste, fraud, and abuse in California's Medicaid program is paid by federal taxpayers, people outside the state of California. And while there's significant waste, fraud, and abuse in every state's program because of the incentives, California is really the hot spot and probably the most egregious example in the country of a mismanaged, wasteful Medicaid program.
Now, California doesn't make money on this. It loses some money, but that money would go to the Medicare patients anyway, right? The ones that really need help. But what they've done to set up this grift is saying, well, we're going to pay people who don't need help. I understand there was one hospice in somebody's garage. I mean, that was how bad the fraud is in California. Now, does California have any kind of law enforcement looking at this at all to try to prevent the fraud?
Yeah, so Dr. Oz has done particularly good work here. He's flagged, I think, 400 hospices in Los Angeles that were fraudulent. You know, 1/3 of all hospices in the country are in Los Angeles, and they took action against these providers, and very few of them have appealed. You know, the state did some very minor oversight over the last couple of years, but just a fraction of the total problem. It really has been the attention that this fraud task force, led by Vice President Vance, with Dr. Oz as the administrator for Center of Medicare and Medicaid Services, they've really brought additional attention and done significant action to close down these fraudulent hospices in Los Angeles.
What's the difference between the LA grift and the Somali thing in Minneapolis?
So, I mean, one of the differences is the Somali problem was related to autism. So they were paying parents to have their kids diagnosed with autism so that they could maximize billing. The other problem out of Minnesota was those sham daycare centers. Now, that's not a Medicaid program, but that is another federally supported program. In California, we've also seen an ethnic entity really involved with the fraud, the Armenians. And I think one of the factors that Dr. Oz is looking at is in a lot of these big cities, you have ethnic groups that have developed fraud schemes and are ripping off the federal government, and in many cases taking the money, the loot that they get, out of the country.
Okay, so Armenians, first I've heard of this, are involved with the fraud in LA, Somalis in Minneapolis. Now, Governor Newsom looks like he's going to run for president. Does he have a defense here? Can he defend saying, well, I tried to clean this up or I did whatever? Is there anything that he did?
I mean, I think he's made the problem worse, Bill. If you look at Medicaid spending, the growth trajectory of Medicaid spending since he's been governor, California has one of the highest growing Medicaid programs in the country. It is really unsustainable. They've also done a lot of financial gimmicks. One of the things that Paragon wrote about last year was a California, really this money laundering scheme where they were able to get federal tax dollars to expand Medicaid to all unauthorized immigrants in the state. I don't think Gavin Newsom has a track record of being a good steward of Medicaid and protecting that program for the most vulnerable. And in California, it really is out of control. Almost 40% of all of Californians are enrolled in this welfare program.
So almost 40% receive some kind of Medicaid, I should say. And that
Medicaid
includes undocumented aliens?
It does. California expanded Medicaid to cover all unauthorized immigrants in the state back in 2024. Of course, that had costs that ended up being much greater than expected. So they have looked to dial that back. But yeah, I mean, it was one of his main health policy agenda items a few years ago.
So did the state legislature in Sacramento okay that, or was it just a executive order by Newsom?
So here's what the state did, and it took advantage of the open-ended reimbursement. It engaged in was a legal money laundering tactic. The way that this works, the state taxed managed care plans. It taxed them, say, $10 billion. It then spent that $10 billion right back on those managed care plans. That is an accounting gimmick. It was $10 billion going from the insurer to the state back to the insurer. But then what the state did was invoice the federal government as if that was an actual expense. So the state got about, I think, $10 billion in additional money from the federal government for that accounting gimmick. And the next year, they expanded Medicaid to cover all unauthorized immigrants in the state. One of the good reforms in the One Big Beautiful Bill was to shut down that loophole, so California can no longer take advantage of it, and other states can't either.
Was that under Biden?
No, that was so they expanded it to unauthorized immigrants. That was approved under President Biden, and it was shut down by the reconciliation bill that President Trump signed.
Okay. But Biden did know about it, did approve it.
That's correct.
All right, Doctor, we appreciate the candor, and I hope we can talk again soon. Let us know if anything else breaks out there.